The 2E2 30-day readmission module facilitates the capture, tracking and automation of patient care plans through the patient journey. One of the key goals is to enable acute trusts to share the care plan with users outside the acute setting, such as GPs, other primary care clinicians, mental health clinical staff, community care staff and social care workers. This helps to ensure that the alerts and notifications are made available to all staff involved in the patient's care to prevent emergency readmissions to the acute setting. The solution provides integration capability to capture the initial admission of the patient from a patient administration system or electronic patient record. The patient's treatment information is then fed through to a multidisciplinary team who build the electronic care plan consisting of a number of key intervention activities delivered by responsible parties based both inside and outside the acute setting. As part of this solution, 2E2 work closely with the Trust to deliver a full end-user adoption program which ensures all users both in the acute setting and at any partner organisation are fully trained. The care plan can now be shared with external users via the 2E2 portal. This enables users in primary care, mental health, community care and social care to view and update the patient care plan based on key activities assigned to them. If the patient subsequently represents within the 30-day window, both the responsible practitioner and case manager can be alerted to this via email and SMS, allowing them to react accordingly. If we look at the record in Microsoft Dynamics CRM, we can see that Mickey has been admitted through A&E in a diabetic coma. We can create a template care plan in Dynamics CRM based on the clinical category using the Start dialog button. We can now see in the dialog that a care plan will be created based on the diabetes predefined template. By clicking Next, we see a hyperlink to that created care plan. Looking at the care plan record, we can see that activities specific to controlling Mickey's diabetes have been created. We can see the diabetes goal record and the blood test record, which capture specific diabetic information and can be assigned to a responsible practitioner depending on the rules specified by the Trust. We also have the option in the care plan creation process to add elements to the plan. In this instance, we'll add a task to send a Living with Diabetes information pack as Mickey is having problems dealing with his newly diagnosed condition. We can also add further elements to the care plan, but in this instance we will say no to conclude the care plan creation process. We can now browse to Mickey's care plan record and we can see the template activities along with the additional task we created. We also have the option to produce a hard copy of the patient's care plan at this point if required. If the action to send the information pack is assigned to a user within the Trust, the activity will be displayed in that user's Outlook client and will create a pop-up reminder to prompt for the activity to be completed. Once we have marked this activity as complete, we can see this reflected in the completed activities pane of the care plan. Now the care plan is created, we can see the required activities specifically related to Mickey's diabetes. We can also trigger reminders to the patient using the inbuilt workflow components and SMS services. In this case, we can see the automated reminder message displayed on Mickey's phone to remind him about the upcoming blood test. So, once Mickey has been discharged, the emphasis on progressing the care plan will move from the acute trust to the GP surgery. The GP surgery doesn't have direct access to Dynamics CRM. However, using the 2E2 clinical portal, we can securely log in through any browser-enabled device. It is important to note that portal access to the care plan is not limited to just primary and secondary care. The clinical portal can help share the care plan with any practitioner involved in the care of the patient, whether that's social care, community care, mental health, or the GP surgery. Once logged in, we can search for patients we have visibility of through their first name, last name, or NHS number. We'll find Mickey in this instance and click into the care plan we have just created. We can see all the activities we are responsible for, depending on our role with this patient's care, and have the ability to add, edit, and submit the information back to the CRM database. In this instance, we're going to enter the results of the blood test. Notice the information is instantly available in CRM to all users who have the correct level of access. One further benefit to utilizing the Dynamics CRM component is the capacity to capture performance-related information based on the actual care plan, clinical category, and actual readmission rates. All this can be displayed in configurable inline charts reflecting the live data. If we look at the care plans by clinical category, we can see that most care plans are currently based on diabetes. We can also drill down into this chart to see the rate of readmissions. We can see patients by GP surgeries who are having problems with readmissions, along with the clinical category. So, in this instance, Fantasia Medical Centre is having problems with diabetes readmissions. We can quickly see this visualization and drill down to individual patient level. So, in conclusion, we can see how the 2E2 30-day readmissions module can provide a platform to build care plan templates and provide remote, browser-agnostic secure access to external parties, improving the transition from the acute care environment to community care, and in turn reducing the emergency readmission risk to the Trust. For further information, please call 0844 225 0526 or email 30day-readmissions@2e2.com. Many thanks for listening.